Hi, I'm Dr. Yuval Bibi. I'm a board-certified dermatologist, and I'm on a mission to help people with sensitive skin turn their life around and get over the nonsense of skincare. So if you have dry, sensitive skin or have rosacea, perioral dermatitis, or any other condition that is causing your skin to be sensitive, you may want to hear this. And what I found in my practice of many years, having treated thousands and thousands of patients, is that people who actually take advice, listen to the advice, take it to heart, and execute the advice to the T, turn their skin around. Most people turn their sensitive skin around to the point where it doesn't bother them, or even to the point where it's no longer sensitive at all. There's no problem anymore once they've realized what it is that they're doing that is making their skin worse. Now, obviously, sensitive skin, which is categorically skin that doesn't have a functioning skin barrier, can be caused by many different conditions and causes. Genetics is one, rosacea, perioral dermatitis, seborrheic dermatitis, other inflammatory skin conditions, maybe even sometimes chronic infections. Those can all result in sensitive skin with a malfunctioning or not properly functioning skin barrier. So all these things obviously need to be addressed. If they're chronic and not responding to whatever it is you tried at home, seek your board-certified dermatologist to turn things around and fix that. However, once you fixed the inflammatory condition that's undermining your skin and are in remission, for many people, the problem of sensitive skin persists. And what I've found is that many people with dry, sensitive skin do what most people do, which is to stick to their guns of skincare. So the advice that I give in clinic, which is often very stunning to a lot of people, is that their skincare that they've been accustomed to for many, many years, sometimes even decades, is not working for them. It's actually making them work for skincare. So more often than not, you are basically taking skincare products that have very little benefit to you, are using them on your skin, and are creating damage to your skin. And if you have a skincare barrier problem, obviously that translates to a worse problem, or being stuck in the same place without being able to turn things around. That is the problem that people who are used to dealing with skincare, used to doing skincare, and have been doing that for a very long time, are facing. They have what's called the sunk cost fallacy for many of them. They're basically saying to themselves, well, I've invested all this time and money and heart into skincare thinking I'm going to get a benefit. I think I'm going to continue doing that, because if I throw the baby out with the bathwater, or whatever other expression they're using, they're thinking that, well, I've bought in. I paid all this money. How can I just call the bet off and stop it? And that is a problem that keeps a lot of people stuck. So people have to contend with the fact that they've invested a lot of time and money in something that doesn't work for them. In fact, it makes them worse. And it's almost like giving up a bad habit or getting out of a bad relationship where you've invested a lot of time and money and resources into this thing. Especially relationships are very hard to give up when they're bad and they're long-term, and you've known the person for a while and there's other attachments, and it's very difficult to give that person up in many cases. But that's the only solution to many of those problems or situations. You have to give some things up to make a change, a significant and meaningful change. As far as habits are concerned, there are habits that are mental or physical or any other attachments that are there, and those are difficult to break. And there are some things that attach people to their skincare, such as the experience. Skincare is, by and large, an experiential theater where people engage in this performative art in front of the mirror. They put things on. They think they're getting benefit. There's a whole ritualistic element to it. So there are many different attachments that people have to their skincare. And then there's the sunk cost fallacy that I mentioned, because of all that time, money, and resources that were invested into the skincare. So it's very difficult to give up. So the first group of people are basically people who are not ready to give up their skincare, and they're basically going to continue doing what they're doing and end up with the same results as they used to. Now there's another category of people who are a little bit more subtle about what they do. Those people are the put my stamp on things kind of people, and they want to continue doing something, just hold on to a little something that they like or they think is not going to do any harm or not going to make any problems. And those people end up getting often the very same results that the stick to your guns kind of crowd gets, which is to continue to have sensitive skin. And why is that? Well, sensitive skin is already categorically on edge, meaning it's missing a lot of the ingredients that make up the skin barrier, or the skin barrier is just not functioning properly for whatever reason. And it takes a little tick or a little flick in many cases to push the skin off the edge. The skin doesn't care that you are thinking, well, what's the harm, and using just a little tiny bit of that exfoliant, or maybe getting a facial once in a while, or maybe just sticking to that gentle cleanser because it's gentle, and what harm can it do? The skin doesn't care. If the skin doesn't have its things together, if the skin barrier is not together and it's missing ingredients, if you're doing even the tiniest little bit of damage to it, it's not going to make up for the difference or the deficit, and it's not going to catch up. Certainly not as effectively as it would if you would stop skincare altogether and let the skin catch up on its own. So if you have sensitive dry skin for whatever reason, whether it's the genetic reason, whether it's rosacea or perioral dermatitis or seborrheic dermatitis or any other skin condition, you've turned your condition around, the condition is in remission, but you still are suffering from sensitive skin, consider letting go and finding out how you can give up your skincare, which is not helping you. It is damaging your skin. It is taking up your time, money, and resources, your hard-earned money and resources, and spending it on something that is not helping you and in fact is keeping you stuck. So consider giving up the stubbornness on your skincare. Consider giving up putting your stamp on things or doing your thing for a moment. Take a step back from it. Stick to the recommendations that are designed to make your skin better by not making it worse first, then making up for the damage or helping the skin make up for the damage in its own time. And stick to those recommendations, be adamant about them, and you'll get your skin back functioning normally and get your life back in order and not focus on your skincare anymore. Let me know in the comment section if you're a stick to your guns kind of person, put my stamp on things kind of person, or you've actually taken the recommendations and turned your skin around. For more information about skincare scams, shenanigans, and tomfoolery, not to mention really terrible, horrible, no good skincare, pick up my book, 6 Skin, Skincare Made Simple on Amazon.com, now available in audio. Thanks for watching. God bless.